sun. Here comes the sun. I say it's all right.
Welcome back to Morning in America. Delighted to have Tim Murphy, Congressman for the 18th District of Pennsylvania. Dr. Murphy, Ph.D. in psychology, practicing psychologist, has some very important ideas. Representative Murphy, welcome back.
It's great to be with you again, Bill. Thank you.
You bet. I was watching and just grinding my teeth. Someone was saying, well, here we go. We have these shootings, but, what's the federal government doing? Nothing. Nobody has any good ideas. Man, I wrote them right away and said, Tim Murphy, get to Tim Murphy. What you're doing is very, very important. If you would just tell our listeners, because they can help move this thing, tell us what you're proposing and why in light of Umpqua and other things.
Well, thanks for the opportunity. Basically what we have is a federal system that's scattered across 112 programs and agencies that, according to a General Accounting Office report, said they're disjointed. They don't work together, even though they're required to do so. Many of them haven't even met together since 2009. I think there's over 20 different homeless programs. And think about this. For people who are mentally ill, particularly someone who's emerging in those late teen to early adult years, when serious mental illness develops for 75% of people with serious mental illness, comes up age 24, at that time they need help the most, and that's when they can't access it. As education programs drop off at age 21, and these programs should be there to help pick up the slack. They're not there. And the key federal agency in this, a program called SAMHSA, Substance Abuse and Mental Health Services Administration, doesn't even work in the serious mental illness space. They're into happiness and wellness and give you advice on drinking your fruit smoothie if you're feeling stressed, websites on how to deal with snow anxiety if you live in Boston, silly things like that. What this bill does, it's the first and most comprehensive reform measure we've dealt with in the federal government. It removes some of the barriers that Medicaid has there for low-income families. For example, Medicaid says you can't bill for seeing two doctors in the same day. What a shame if the pediatrician identifies a teenager with serious problems. They can't see a psychiatrist or psychologist in the office. They have to come back another day. Yeah. Medicaid has a rule that says if you're low income, you can't go to a hospital that has more than 16 beds, even if you're in the midst of a breakdown. Medicaid has tried to even say you can't take certain psychotropic medications, even though they may be more effective. And then we have a huge shortage of psychiatrists, psychologists, clinical social workers, and peer support folks to help people through the recovery. We have to have more. But it's this disjointed approach. The approach that the federal government has of throwing money out there but not having this work together is something we want to overcome. Okay. I first introduced this bill a couple years ago after a year of hearings and delving into this. Reintroduced it this summer with a lot of reforms. We now have, I think, 138 co-sponsors, bipartisan, but we have a lot of work to do.
Well, let's get to the commercial right away. What do you want our listeners to do? Who do they contact, and what's the bill number and name and so on?
Bottom line, it's H.R. 2646, the Helping Families and Mental Health Crisis Act. Please contact your congressman. Ask them to co-sponsor this bill and to support it. This is the measure that will make a difference in preventing things like the Oregon shooter or name a city in America where we've had these crises.
Let's get specific without we don't like to mention the shooters' names, but any of these circumstances you've looked at, there seems to be a cluster, correct me if I'm wrong, of these events where there's a lack of communication, failure of communication, or inability to act on the part of the parent who may or may not be plugged into what the young person is doing. In some cases, you correct me if I'm wrong, you know the record much better than I do. Some cases, seems to me the parents are agonizing over what to do, but are limited because of some of the provisions you're talking about. In other cases, they're not connected. I noticed the father here out there in Umpqua said, "Oh, really? He had 8 guns? I didn't know." Well, he hasn't been around for 13 years, and we see that a lot. Talk about both the connected and disconnected parent.
Well, you can have connected parents who are begging for help. You have shooters who the parents try to immobilize the person's car, get them in hospitals, get them help. The laws are, unless that person is in imminent danger, and basically saying they're going to harm someone or themselves, hospitals won't take them in. And by the way, Bill, unless you have an involuntary commitment they can still purchase a weapon. So when people talk about doing background checks, a background check is useless with no background to check. And there are some people that say you should never have an involuntary commitment. Look, I think it's rare in my career. I haven't done it, but I know there's some people who are so disturbed and do not understand, literally do not understand, that their hallucinations or delusions are a problem, that they sometimes need help. The second thing is, doctors who may know there's a problem will not talk to parents. This has a multiple levels. They may not say, your son or daughter is in treatment, here's a hospital, or they won't even go so far as saying that, because many times people with serious mental illness will have higher risk for diabetes, heart disease, infections, etc. They won't even tell the parents, hey, make sure you bring your son or daughter, brother, sister, whoever it is, to the endocrinologist. They have diabetes. They're not taking their insulin. And so this is part of the symptom cluster that causes the person with serious mental illness to die 25 years sooner than other people, because they're not getting help. But it's not surprising, therefore, when you hear parents say, I never knew this was going on. The shooter at Virginia Tech, the mother said, no one ever told me he had a problem. Yeah,
those parents in Tucson, as I remember, did know they had a problem. I think he was in and out of counseling and maybe institutions. But the situations vary. You said something like UMCA could be prevented. Tell us how this bill might, in the best circumstances, work to prevent UMCA. What would have happened that didn't happen in this case?
We would have allowed circumstances whereby, first of all, there would have been more providers in the community. I think about a quarter or a third of the counties in Oregon don't even have a psychiatrist in them. There's huge shortage. This would help provide more skilled professionals to be there across the country. Also, community health centers, community mental health centers, ramp up their services that are there. We'd remove the barriers in Medicaid so that a person would have more access to crisis hospitalization if they need it. We'd have more training of peer support counselors, which can be vitally important to reach someone to help them recover. We would also have a provision there that if someone had a history of violence and mental illness, then wraparound services could be mandated through the courts. We would lift some of these gag orders on doctors and parents so they actually could communicate in rare but in vitally important circumstances, because in this case, perhaps no doctor even told the mother what was happening. The mother is operating off a diagnosis in this case that he had autism. We don't know if that's true or not. It could have been that early symptoms he had appeared as that, and it could have been worsening. So these barriers would have been lifted, but still protecting confidentiality and the rights of this person. But I look at this as the person had the right to be well, the right to treatment, and the people who were the victims had the right to live out their lives. Yeah. And this is part of the balance, part of the battle we're facing here.
All right, we're talking to Tim Murphy, Dr. Tim Murphy, Congressman for the 18th District of Pennsylvania. Again, the bill is H.R. 2626. Let me ask
2646.
2646, I'm sorry, 2646. We'll put it up on the website and we'll put it up correctly. Supposing you have a 20-year-old living in your house and he's got a collection of guns. He's writing on his website how much he admires these killers. That's how you get in the limelight. He's playing a bunch of video games. He's fantasizing about how great it would to be known for doing things like this. Is that grounds for commitment?
I think so. If you pass that information on to authorities, perhaps I would suggest that a family have a quick conversation with the doctor on that, and that the parent has access to those weapons, lock them up. Okay. That's very, very important. As a provider myself, I would not be allowed to call the family and say the very things you just told me. That's the perfect line of questioning, because confidentiality, all of the laws would prevent me from doing that. But a parent can make the call to a doctor. This is part of the communication problem we have that we want to fix.
And it changes at 22, right? And you want to.
Yes.
You should be able to.
Well, yes. We
should be able to make that call at any age, it seems to me.
At age 18, the communication drops off.
Okay. How many people are there like that? I mean, do you have any idea? Is it 1% of males?
There's about 11 million Americans with serious mental illness. About 4 million of those are not in treatment. If you drop down the number of people who may be prone to violence, you're pretty much, our prisons are filled with a lot of people who've already been down that road. Is it hundreds of thousands, perhaps? But the key is this. If they're in treatment, they're 15 times less likely to be violent than if they're not in treatment. And if they are abusing any drugs or alcohol, the risk for violence goes up dramatically. When you add to that social isolation, lack of supports, all those things continue to increase risk upwards. And if the person has any history of violence or torturing animals, et cetera, the risk continues to climb.
We know you're very busy at this time, given what the country's talking about. You should be very busy. More attention to you, the better, as far as I'm concerned.
We need the help from every citizen American calling their congressman, because this is a life and death matter to get this system changed.
H.R. 2646, Tim Murphy, Republican from Pennsylvania. Thank you very much, sir.
Thank you, Bill. Have a good day.